This year of 911 mental health calls is concerning, especially now that we're in the holiday season. Pima County is already dealing with an increase of mentally ill inmates in the jail.
Chief investigative reporter Valerie Cavazos talks with those on the front lines about the challenges and an option for family and friends when they fear the person could be a danger to themselves or the public.
Many people can recognize the warning signs of mental illness, but may face challenges in getting a person to seek treatment. We've learned about the surprising number of 911 calls made by the same people. A 911 call made. A man reports people attempting to break into his apartment.
Guys trying to pry open my sliding glass doors on my balcony.
Okay, do you know these people?
No, I do not.
Do you know why they're doing this?
No.
The dispatcher asks for his name. The caller gives it, and then she continues.
Okay, has this happened before?
Yeah, actually it has.
It's not the first time he's called 911. It's the 54th time over the course of a month. Most of the time, he's been transferred to the in-house crisis clinicians for a mental health evaluation. The center keeps track of the counts.
We call it the Familiar Folks Program, and we identify the number of calls that somebody has made in a month.
Anna Corcoran is a center administrator.
The times that they've called 911 is an indicator sometimes, right? Nobody calls 911 more than maybe once or twice in their lifetime. There's something going on there.
The data on the highest call generators are evaluated and shared with different mental health providers in Pima County. Law enforcement is also looped in.
So they do some follow-up and care coordination with individuals who are calling 911. And those programs have success.
But that's if a 911 call is made by them or concerned family or friends. Sometimes there's a reluctance to pick up the phone out of fear of the unknown, thinking a 911 call could equal an arrest.
It's hard, right? They call 911 because they want us to help and fix the issue. But then if something turns into a violent encounter, I'm sure they probably wish they never would have called 911.
She says some fear that they'll be forced into mental treatment that they don't want. Some want to ditch their treatment, and some don't even realize they have a mental illness. But Duffy says it's critical someone steps up before a crisis escalates into a crime and ends in handcuffs and jail.
And I think a lot of people think they're an adult, we can't force them into treatment. But you can document that their behavior, they're either a danger to themselves or others, and they can at least require them to be seen.
It's done through mental health court orders.
And that means that a judge has ordered that they have to come in for an involuntary evaluation.
The legal process is called petitioning, or Title 36. The court can order someone to undergo an evaluation without their consent and order treatment if necessary. Law enforcement, medical, and legal professionals rely on these court orders. Family and community members can as well.
So my team will go out, we will serve, and TPD has the same program, so we'll take them to Banner South, or we could take them to a different facility as well.
Data shows, on average, about 3,500 petitions have been filed in Pima County each year from 2018 to 2022.
So at a minimum, they're at least seen by a doctor. So then at least you get them in the system.
And this year, the count is trending towards a 10% jump, an uptick they'd rather see before someone is in a crisis or commits a crime.
If you see somebody in crisis, please call. We're not out there to jam them up and take them to jail. We want to get them help.
Calling 988, the nation's newest crisis line, is also an option. And you can check out our entire mental illness crimes series on our website, KOLD.com. Valerie Cavazos, 13 News Investigates.